a few words about, a few things. One is that we started the day with lessons from other sectors, the health sector internationally, the legal sector here in the United States, knowing that these are sectors that have quite a bit to teach us and that we are at the beginning of a very long process, and that we have, thankfully, the Global Social Service Workforce Alliance to help galvanize those efforts. But another thing I wanted to mention is that we very explicitly wanted domestically focused and internationally focused people in conversation. And this is not to say that what we know in the US is better or more advanced. I think Jane made the case very strongly that we are quite a ways away from an effective system with effective social work practice that helps children and families. So I think the dialogue between these two is very crucial to us. We are now turning squarely to the social service workforce itself, both domestically and internationally, and we have an extremely exciting panel ahead of us. This is the state of the evidence. Where are we starting from? What do we know today? Moderating this session is an old friend and a pioneer among this kind of work. She never likes it when I say that, but Maury Mendenhall. Since 2009, Maury Mendenhall has served as Senior Technical Advisor for USAID's Office of HIV and AIDS, specializing in programming to mitigate the impact of HIV and AIDS on orphans and vulnerable children. In this capacity, she works in collaboration with U.S. government country teams to support project design, management, and strategic planning processes. She's responsible for strengthening the technical capacity of host governments, non-government organizations, community-based organizations, faith-based organizations, and others to address the multidimensional needs of children orphaned and made vulnerable by HIV and other forms of adversity. Her areas of expertise include social service system strengthening and child protection. Prior to joining USAID, Ms. Mendenhall worked as a senior technical specialist for the Child and Youth Program at World Learning, the Emergency Child and Youth Protection and Development Coordinator for the International Rescue Committee, a child protection specialist for UNICEF in Southern Sudan, now South Sudan, and as a presidential management fellow at the U.S. Department of Labor's International Child Labor Program. Over to you, Maury. Thank you.
Yeah, I don't know about a pioneer, but I am an enthusiastic cheerleader for the social service workforce. But to my great regret, enthusiasm hasn't necessarily been enough to justify channeling millions of dollars towards workforce strengthening. And what I really have craved over the years is the kind of evidence that we're talking about today. So it's a real pleasure for me to be here today and to learn from you all more about what we know and more about what we're learning about the workforce. Within the President's Emergency Plan for AIDS Relief, where I work with Jessica and Jim and others, I've benefited a lot from what you all have done within the field of workforce strengthening the health workforce. And as I mentioned earlier this morning, have been very, very envious of your statistics and your numbers and your evidence. So I'm taking detailed notes here so that I can go back and I can make a case for the workforce. We have 4 panelists on this particular panel this morning, so I'm not going to say very much. I'm going to go ahead and introduce our first panelist, Joan Zlotnik. A phenomenal name. I love your name. And Joan currently serves as the director of the National Association of Social Workers think tank, the Social Work Policy Institute. She's an internationally recognized expert on workforce issues and the author of numerous publications, including publications on accessing federal funding, child welfare partnerships, competencies, and evidence-based practice. She's served on the Institute of Medicine's Committee on Child Maltreatment Research, Policy and Practice for the Next Decade, the Dual Eligible Beneficiaries Work Group of the National Quality Forum's Measure Application Partnership. I'm very proud of myself for getting through that.
That's what healthcare reform brought to us.
The CDC Knowledge to Action think tank on child maltreatment prevention, and the National Advisory Committee for the National Child Welfare Workforce Institute. She's also led several foundation-funded projects on interprofessional education and practice, university agency research partnerships, and competencies for family-centered care. And her presentation today will focus on lessons learned from organized efforts to recruit and retain social workers for child welfare practice, especially in public child welfare agencies. So, thank you very much.
So I'm really thrilled to be here today, and after the reporting panel, I really thought about maybe I'm going to change everything that I'm going to say, because some of the things I'm going to talk about are things that, in terms of the health workforce, were addressed, or some of the dilemmas that Jane talked about. So I will kind of go with that. I did start my social work career as a candy striper at Queens General Hospital in Queens, where I grew up, where I was a levy. So, like, the only place in the world where you could be a levy and not a levy is actually in New York City. So we know Maury did not grow up.
No, I was not a candy striper.
So, everyone is different. So I realized that when I was invited by Amy and Mark to speak, I gave them one title and I gave Maury a different title. So you can take whatever title you want: recruitment and retention of the right workforce, lessons from research, or building the evidence for a competent, committed child welfare workforce, lessons from 2 decades of strategies. I think that the sort of overarching theme that might come out all day today is this one of these are issues that people have been working on for a while, and we haven't actually come up with resolutions, but we know a lot more now than we did before. So let me give you a little history. I was hired at the National Association on a part-time temporary basis at NASW in 1987. Dorothy Harris, who was president of NASW at the time, had a presidential initiative on promoting professional social work in public child welfare agencies. This was 1987, and I got hired on a part-time temporary basis to work on that. I then eventually got a full-time job a few months later at NASW, and that portfolio was part of it. And I have kind of taken with me wherever I've gone over the last 25 years, 26 years, to really think about, can we get more professional social workers in child welfare? And what does that mean? Who are they? What are they going to do? Why would they stay? Why would the agencies want them? And my bottom line is that this is a complex set of problems, and there really are no simple answers to it. And when I began thinking about, because of all the conversation that's been going on around well-being, and Brian Samuels, when he was Commissioner of the Administration for Children, Youth, and Families at Department of Health and Human Services, really talked a lot about well-being, I started thinking about this idea about, if we think about parallel process and what we want for kids, and we really want economic security, supportive nurturing caregivers, and one of the things in the bio talked about the CDC committee. CDC really, in their violence prevention office, they really had this thing about safe, stable, and nurturing relationships, and that's what all kids need. Everyone said SSNRs is not going to zing, so they kind of changed the terminology to essentials for childhood, but I think it kind of gets at some of that more universal child protection conceptualization that Jane was talking about. Physical and mental health, safe and secure living arrangements, those are the things for kids. So what do we think in terms of workers? A child welfare worker needs to have reasonable workloads, the skills, knowledges, and resources to implement their work. And we talk now a lot about evidence-based, evidence-supported interventions. They need to have supportive and educational supervision, and in both Helen and Jim's presentations earlier, they talked a lot about supervision. And you really need a quality organizational culture and climate. So I'm going to talk a little more about these as we kind of go through. So we know that making workforce improvement really needs to be a priority. When I came to NASW in 1987, started talking about this with people in other organizations, Children's Defense Fund, Child Welfare League of America, and others, and it's like, yeah. And then in about 2004, the Children's Defense Fund and Children's Rights developed a national workforce policy working group because they suddenly realized that you could make all the changes in the world and the system, and if you don't have the right workforce to do it, it's really hard to do. And I think it was Jim was saying before that what happens, and I think Jane was saying this too, is that you retreat to the way the system functions rather than kind of doing the best practice. So we know turnover is costly, so we want to really think about retention. Because turnover is costly in dollars, and it also is costly in terms of child-family outcomes. And one of the most concrete examples of that is a study done in Milwaukee County, where they showed the number of workers that a child had was totally related to the number of foster care placements a child had. So stable worker, fewer placement, more turnover, because everyone kind of starts again. It's also expensive because it impacts the remaining staff, who then have higher caseloads and more likely to feel overwhelmed. And it's also costly because training, rehiring, all cost money to do. So we really need to think about that in terms of really wanting to cut that down. We also know that paperwork, agency environment and supports, and workload impact the workforce. And the issue about ratios is a really interesting one. When I came to NASW, we had child protection standards that had been developed in 1981, and they said there should be one supervisor to every 25 workers, and or a caseworker should have 25, no more than 25, or 20 to 25 cases. There should be one supervisor for every like 8 workers or something like that. When they redid the standards, they took it out because there's, wasn't a clear science. But I think having those, however they were developed, whether it's time management, time series, or however, is really helpful because it gives people guidance. People call all the time and ask those questions. And then we have these issues around the difficulty of attracting the right workers. What professional qualifications would be optimal? What are the minimum qualifications? And for child welfare in the US, we have this ongoing question, is social work the right degree? Is it the necessary degree for child welfare work? And the way I look at it is we have policies and standards that talk about minimum qualifications of bachelor's in social work for frontline child welfare workers, and should be an MSW for supervisors, and those people should have specialized knowledge and experience in child welfare. But also, the issue is really one of, are these systems where people want to be working? So that it's like, it's a whole gestalt. You can't just like look at it and say, well, we're going to train these people and they're going to go work there, because we see they don't stay. And so we have to really think about the reasons that people don't stay. So what are some of the retention factors? And some of this work is drawn from a systematic review of retention research in child welfare that I did with the University of Maryland in 2005. So what do we have to think about? One of them is the attributes of supervisors. People say over and over again, came up in the data before, supervision and the supportive supervision is critical. Skills in mentoring, a high level of practice knowledge. These are the things that are sort of important for supervisors to have. And that workers stay or attached to their supervisors. In a study that was done of NASW members who work in child welfare, so these are mostly people with MSWs, the professional social workers who stayed didn't report supervision problems. So it's sort of another issue, and sort of like perhaps in a more professionalized workforce, you're more likely, if you already have your master's, to have a supervisor who has a master's or a doctorate. And if you want social work supervisors, because we talk about that, then you need to figure out, you have to hire social workers and promote them. You're not going to get supervisors who have the skills you want if you don't have a career ladder to get people there. And when you think about supervision, there's some elements that are really critical. And in a meeting we did, and I think I left a few copies of the brief from it, but it's also on the tables, there was a handout with a whole bunch of resources from NASW and the Social Work Policy Institute. So all those things are online, and you can look at them, and I think there were a few more on the table. But we really need to think about supervision in terms of administrative supervision, educational supervision, and supportive supervision. And maybe that's all not one person, but then when you get back to these issues of resources, maybe it ends up needing to be one person because you don't have enough capacity to have more than that. So what are some of the personal factors? People who remain in the job have higher job satisfaction in those kind of surveys that Helen was talking about. A goodness of fit, a preference for child welfare, a sense of professional commitment. The stronger commitment to child welfare, the stronger the intention to remain. One of the interesting things about workforce research is they talk a lot about intention to remain or intent to leave. However, it's not really, it's a kind of a proxy, but at least in my own career, I've had a lot greater intentions to leave places than I've actually left them, or that the intention to leave might have gone on for a number of years before I finally left. So it's a proxy, but it's not exactly the same. Workers who receive funding to go to school to earn a degree also have a commitment to stay, at least for a time frame. And what we see is that some of the work also of Bert Ellett at the University of Georgia looks at issues around human caring and intention to remain, so that feeling of wanting to be helping other people is a critical element when you're sort of thinking about what kind of screening you're doing for the people who hire. What kind of elements are you looking for in terms of the people you hire? That previous experience is important, and those without it are more likely to leave. Those without exposure to child welfare, child protection work, more likely to leave. But also, when you have MSWs in the field, particularly where some of the investments have made in getting more MSWs, sometimes because they have a lot more career opportunities, they leave too after their payback. So you really, in some studies that were done in New York State that compared workers who stayed and workers who left in different counties, what they found was that in some of the more rural counties where people had less job opportunities, the survey showed the same kinds of issues that the workers raised, but that they just felt that they didn't have the kind of job opportunities, and in another county that had more job opportunities, those same workers with that same profile actually left. Then there's a set of organizational factors. Manageable workload, and once again, that's a reason it's hard to come up with those data around ratios, because caseload maybe is not the thing to look at, but workload might be more like it because of the different ways that different systems are structured. Peer support is really important. Feeling valued, and that value is both in terms of peers and of the agencies, opportunities for advancement, senses of sort of personal and psychological safety, and those are issues, certainly in terms of child welfare work in the U.S. and some mental health work as well. Any time people are doing home visiting. The availability of resources, that one of the things that the social workers, the NASW members who we surveyed who worked in child welfare said, the thing I find hardest is we don't have the kinds of services and supports that the children and families need. And you start talking to parents, they say, well, if I had housing, I would be able to get my kids back. Or I think in the flip side, I used to run a family preservation program in Northern Virginia, and one of the most trying situations I remember was kids going home before the parent was really ready, because the mother was going to lose her Section 8 housing in a certain amount of time, so the children went home, and you had to think about what were all those supports you needed to put in there to actually get the children to be home and to be safe and to be nurtured as well. So this is just kind of a schematic of the things I was just kind of going through. Workload and caseload, study of agency directors said one of the top reasons that people left was workload. Workers feel overwhelmed and they stay, but they just kind of manage. And this kind of, this came up in our conversation earlier also. So you sort of stay, but you're kind of burned out. Maybe you take a lot of sick days. You don't really care so much anymore. Critical issues in terms of what happens. I think another important issue is that when you ask agency administrators what they do to impact recruitment and retention, they talk about worker training. However, when you look at it, those factors about did you provide this training program, really are not the things that get people to stay. It's supervision, mentorship, peer support, organizational culture, and climate. Burnout, we talked a little about, I think, in Jim's presentation before, and one of the things we really need to think about is work and family life imbalance. I think the issue that Jane raised before is the really critical one. Most of the studies we do about workforce issues don't actually get to the question of, does it really mean better outcomes for kids? We do have some proxy issues when you sort of take those issues of turnover and other things to show that it does actually make a difference. But we don't ask those questions, and part of it is because those are really complex studies to do. Because there's so many factors that impact outcomes. It could be the judge, it could be that the person can't get a job, it could be the mental health problems and all of this. This schematic of these 14 issues was bringing together that policy work group in 2004, 2005, 2006 in terms of what were all the factors, if we really wanted to have positive experience or outcomes for children, what were the workforce issues that we needed to look at? We needed to think about data, competency-based training, manageable caseloads, and all of these things that are absolutely critical. No simple answers to a complex question. I think my time is up. I just want to say one thing about the importance of university-agency partnerships, and you can certainly see that in terms of the speakers that are here today that represent much work that goes on in agencies. So thank you very much. There's resources.
Thank you. Okay, so our next speaker is Rebecca Davis, someone I've known for years and years. And Rebecca Davis is an associate professor and director for the Center for International Social Work. She teaches social work practice and international social work courses at Rutgers University. She has extensive experience in international development, curriculum design, and training in child welfare and protection on a global scale. Dr. Davis is a consultant for child protection system strengthening in sub-Saharan Africa and the former Soviet bloc countries. Her most recent international projects include the development of a case management toolkit for child protection programs in the former Soviet bloc countries, a research study on sexual abuse of children in schools in Liberia, and child protection gap analyses in Nigeria, Swaziland, and Malawi. She co-authored a working paper on child protection system strengthening in sub-Saharan Africa for UNICEF in 2012, and authored a working paper on human capacity within child welfare systems in Africa in 2009, which served as a background paper for social welfare workforce strengthening initiatives in Africa. Dr. Davis's presentation will focus on the use of qualitative case studies for identifying workforce and service gaps in child protection systems.
Thank you very much. I'm going to shift gears a little bit and talk about qualitative studies. We've referred to that this morning. But first I want to know who's in the room. We've been saying, here are your students, a lot of you are students. What schools are you in?
We're all from SUNY New Paltz.
Where?
SUNY New Paltz.
Okay.
There's a bunch of us from Columbia as well.
Okay. Others? I need my hands. One of the things I just wanted to make a comment on, because Amy Bess and I were just talking about, when we talk about the social welfare workforce or the social service workforce, we still haven't figured out exactly what to call that. I just wanted to say that we're really talking about the broader, anybody that works within the child welfare, child protection system, and from paraprofessionals to supervisors, managers, anybody that's at the policy level, people like myself, educators. So it really is a broad, we're referring to a very broad group of people. So my presentation is really using qualitative case studies to do an assessment and mapping of the child protection system. To really begin to look at it through a variety of lenses. And I'll give you a little background on this. I'm working in a number of different countries in sub-Saharan Africa, but in Nigeria, we are using the Maestral toolkit. And I don't know if how many of you are familiar with the Maestral toolkit? Some of you would be. But this is an assessment tool that focuses on titles or descriptions for people working in public services. It gets what quantitative data there is, tries to find out how many authorized, filled, and vacant positions there are, qualified, not qualified staff, what caseloads look like, any information on recruitment and turnover, professional associations, education and training, perceptions of quality and education, quality of education and training. And then we take the different parts of the toolkit, information obtained, and then look at system building priorities, which refer to laws and policies, cooperation, collaboration, capacity, services, public awareness, education, and accountability. So, and I'm just giving you a brief description of this because as we were looking at doing the assessments in Nigeria, the UNICEF child protection officer there kept saying something's missing, just something's missing. This is important information, but I feel like there's something else that we need to do. And I said, well, why don't we do case studies? And so we pulled together this approach to do this. So I developed, we use case studies to evaluate students' learning in social work. So we use case studies for a lot of different reasons. So what I'm going to show you is actually we were doing validation workshops in six states in Nigeria. And in these workshops, there were anywhere from 40 to 60 stakeholders. These were lawyers, these were people from education, health, social welfare, as well as NGOs. It was a broad range of people at the workshops. And so I did this little training for them in terms of why do qualitative case studies. And so it's a methodology for studying complex phenomenon in context, promotes effective contextualized reflection on practice. And it's very important in studying child protection because you can explore complex processes at multiple levels, individual, family, community, organization, and system. And the phenomenon, for example, child sexual abuse, within context. And one of the reasons this is so important is because we keep talking about the importance of context in child protection, really understanding the cultural context, the local context. And so in using the qualitative case studies, we're really looking at the problem through different lenses, but also in real time. I'm not going to get through all of my slides, I know, so the participants love this. Truth is relative. Because it really depends on who you're talking to. And I think that's one of the things that the case study approach. They can tell their stories, they can hear each other's stories, and it's really these collective stories that give meaning as to why certain decisions were made, the pathways that children take to go through the system, and issues related to problem identification and to outcome. So we were using this case study approach to really look at decision making, how decisions got made. And we wanted to know we had questions like who worked with whom, who didn't work with who was included, excluded, what were some of the power differentials, were boundaries really rigid in terms of who was going to be managing the particular child issue, what did teamwork look like, and what were some of the outcomes. I just wanted to bear with me here, just to show you what we pulled together to do this. I don't know if you can see this. So we had before we had the workshops, we had our local consultants work with different service providers within the state and submit case studies. So I had a format for them to do the case study. Then I took the case study and put it in this pathways chart with basic information about the child, the family, the community, what happened, what was the child protection violation, who committed it, when, where, who was it reported to, who reported it, when, and how long after the incident. And then I followed the different referrals. Who was it that was involved in this case? And looked at the time frame. Sorry. And then what the outcomes were. And so we broke them up into small groups, and then they each discussed these cases. And then I had a discussion guide that we used.
You're trying to get back to your slides?
Yep.
You're over there on the left.
Right here. So basically, what we wanted the group to do was we said these are illustrative of gaps in the system. We didn't want them to get caught up in the details of the case, which was very difficult because I think every group I was facilitating, it was somebody in that room's case, and they would get very caught up and because they had a lot of investment in it. But the idea was to link the case inputs and outcomes to what the system building priorities were. And they really were able to do this quite well. What gaps do you see that contributed to the specific pathways the cases took? And what specific system changes might alter the trajectory that some of these cases took as they moved through the system? So basically, with the workforce capacity services and service delivery mechanisms is some of the priorities. So we asked them, to talk about problem identification and definition. What was the identified problem? Are there other problems that were identified? Were there earlier signs? And this was a key issue. Were assessments done? What assessment of the family and community were done? How about timeliness in terms of the interventions? I don't know, but something's not. I lost it. What? I lost it. Anyhow.
There we go. It's back.
I thought that was part of the case where you started with a blank slate.
Right. I don't know what I've done, but.
I think there's just a bunch entered blank slides. If you go
Yeah.
to the ends, there might be more
Yeah, I
content.
think you're right.
Yeah.
Yeah,
If
go
you
all
go
the way
all the way to
down.
the bottom, there.
Yeah.
Yeah, because I want to get to the,
Do you know how many slides you had? Yeah, there.
about
There it
10.
is.
I only
Yeah.
had about 10.
Well, now there's 50. So that would explain.
Just to take a few more minutes here to go through these other 50 slides.
There's two.
I think what happened is it inserted a whole bunch of blank slides.
Okay, right here, so, yeah. Yeah. I have a few minutes, so that took up a little bit of time. I don't know how I did that. And so we also asked about coordination, cooperation, collaboration, and accountability in terms of people being held accountable. So, and then we debriefed with the participants with each of the system building priorities. For example, capacity of workforce. An example would be lack of capacity frontline workforce to do assessments, case planning, and referral, which was a very common one. Lack of trauma counseling for victims of sexual assault. This was a huge issue that came out over and over. And financial resources, lack of resources to support home visits by social welfare officers and case managers. So there was a lot, each of these system building priorities, all of these impacted workforce in some way. So just some of the observations from the case studies. And again, I think this is where, as we were talking before, you know, you have to look at the positives as well as the negatives, I think. And even though there were many problems, there were many good Samaritans, child advocates, NGOs, and public servants who really want to do the right thing. And people really were concerned. Good descriptions of multidisciplinary problem solving and cross-sector referral. We saw a lot of that in the case studies. In some cases, decision making was very strategic, and stakeholders attributed case study discussions to an increasing awareness on their own part as to how, I mean, just doing the case studies and having the discussion. They said they really became much more aware of how complicated and the importance of the coordination and cooperation. So there was a learning that took place from that. Some of the gaps that they identified, one of the common ones was that there were problems that existed long before, but it was only when a child got pregnant that it came out that the child had been being sexually abused. Gatekeeping functions, there was a lot of focus on getting somebody to take care of the child, somewhere to put the child. Not a whole lot of discussions as to what other needs the child might have, what other needs the family might have, so very short term. Assessment and case planning was very rarely done. Very rarely was there an assessment done. Very little emphasis on child's development, family strengths, well-being outcomes. And many of these cases were cases of sexual assault. The focus, you could follow the referral pathway, and the focus got onto prosecuting the perpetrators. And I kept saying, well, what happened to the child? It just got lost in the system. And alternative care was primarily residential care. Decision-making ad hoc, influenced a lot by personal interest, and that could also be political interest. And overall, just a lack of knowledge and skills in working with families in conflict. So again, you know, we're learning the same thing that you learn from other types of assessment tools, but it engaged them in a very participatory way that we felt had a lot of good outcomes. Now I will say that my time's up, but
She's ruthless.
Sorry.
but I have to do that. I have student presentations this weekend, so I'm gonna. That we're learning, as Jim, you were talking about this. We don't really know the best way to do these assessments, and so this is something that we just tried and seemed to work well for us in Nigeria in these particular states. So again, I just wanted to point out that we're really still trying to figure out what's the best way to really understand how to assess and what is it that we're really looking forward for change.
Thanks so much, Becky. So we are going to now hear from Maury Hickmann. And Maury is an M&E advisor for Futures Group International, currently working on the USAID PEPFAR-funded project Measure Evaluation. Her work focuses on creating approaches to guide governments on strengthening the social service workforce in developing countries. She's supported strengthening social service systems in Tanzania, Nigeria, and Rwanda, and is leading an effort to develop global indicators to guide governments in monitoring their social service workforce. She previously advised the Federal Ministry of Women's Affairs in Nigeria on developing strategies to assess and strengthen the national social service workforce. Ms. Hickmann has over 7 years' experience in advising foundations, nonprofits, and local governments in Kenya, Ghana, India, Nigeria, Tanzania, Rwanda, Ethiopia, and Guyana. Ms. Hickmann's presentation will focus on a process for developing guidance for countries to use to collect evidence on the strength of the social service workforce and use this evidence to inform program and policy decisions.
Wow, thank you. All right. That's what you're going to talk about. I think it's really building off of what Rebecca just said, that we're currently working on a project to help us figure out how we want to assess the social service system strengthening, including the workforce, and that we are working on it. So it's coming along, and there are a lot of lessons we have learned and continue to learn as we put this together. So with that being said, what I am presenting on is a project that is in progress. So we don't have results to share with you around specific numbers, but rather we're looking at an approach to bring information together. It's under Measure Evaluation, which is a global project that supports monitoring and evaluation of health. There's a smaller group of us that work primarily with the Orphans and Vulnerable Children Technical Working Group at USAID to look at M&E globally. So we are looking at the international perspective, trying to pull some learning from other systems and workforce strengthening as well, but really looking at the application across countries, mostly sub-Saharan Africa. So I don't think this is new to many people here, but just to let you know a little bit about where we're coming from. With this project, it's been underway for about 1.5 years now, if not 2 years, but I'd say we've been moving forward pretty quickly over the last 1.5 years. And it's coming from the shift under PEPFAR to strengthen social service systems. And that has become a priority for PEPFAR, and as that has become a priority, PEPFAR is asking the question of how can we continue to monitor the outputs and outcomes and impact of what we're doing. So we've been working very closely with Maury Mendenhall and the OVC-TWG, as well as the Global Social Welfare Workforce Alliance, and putting together indicators on looking at the system, including the workforce. I think it's important to acknowledge the difference between the formal and informal system in this, and it's something that we continually talk about and have talked about over the last 1.5 years. We fully recognize that there is a formal government-led system that exists and is being strengthened in all of these countries. There is also a very important informal system of community practices. I think one of the things that we've learned and one of the things we believe right now is that the type of information that is needed for both the formal and informal, as well as the data analysis, collection processes, and how we would use that information is different, yet linked. So I say this because what we have decided to focus on right now is the formal system, and it's not to say that informal is not important, it's quite the opposite actually. But in this area where we really feel like we're building something that doesn't exist in a lot of countries that we are hoping to apply it in, we're needing to start with one component of the system and focusing on the formal first. We also, so the workforce is one component of system strengthening, and the components of strengthening a system that PEPFAR has put forward in the OVC PEPFAR guidance from 2012 includes other components of system strengthening as well, such as leadership and governance, coordination, financing, and information management systems. I think for the workforce, one of the things that we've also learned over the last year and a half and are trying to work towards is the understanding that these building blocks don't work in isolation. It's quite the opposite. They really work together. So, you know, I have them bulleted out here on the slide, but that's really not how they interact. Particularly with the workforce, we know that, for example, there are components of leadership and governance for the workforce that are really important and that are being developed. We know that coordination is really important for the workforce. We know that financing, of course, is a huge issue for the workforce, and that having information available and information systems is equally as important. We have put this in the context of a larger framework to think about system strengthening and what we're trying to achieve by that. So the way that we're framing it right now is that system strengthening is what we're hoping to measure, and that is an input to achieve more effective welfare and protection services for children and families with the ultimate goal of improving well-being. And I say this just to give us a broad overview of how we think about system strengthening, but to also say that right now we are focusing on developing indicators that fit into the input side of this, and that what we're questioning is what are the outcomes of system strengthening and how can we measure a lot of the outcomes that are happening to strengthen systems. We're also thinking about the output here and the impact that I have up on the screen. And we're not thinking of measuring systems in isolation, but we are focusing right now on the input side and looking later at the service provision and the welfare side. So we started this activity knowing that it was going to be applied globally, so needing to know what exists and what is needed and try to fill that gap. So we did do an extensive research process to learn from other countries, including the United States and including a lot of other countries, to try to figure out where we were at and what we needed to try to measure. So in the context of the workforce specifically, I think that all these areas have been touched on today, but we know that there are inadequate regulations for the workforce. We know that, for example, South Africa has done some work on creating a career ladder for different cadres of the workforce, and they're kind of the pioneer on the continent of sub-Saharan Africa. Other countries have done some work on this, but some countries are still really lagging in this. So that is a priority area for strengthening the workforce in PEPFAR countries. We also know that the workforce is very much under-resourced, which I don't think is a surprise to anyone here, but further we know that of the information that exists, it's not really possible for countries to even have accurate projections to be able to figure out how to adequately finance the workforce. So there's some analyses that have been done, and Capacity Plus and USAID have definitely helped bring a lot of that information together, but it's the information for countries to even be able to talk about how they need to grow their workforce is oftentimes not available to support for, say, national level advocacy. We also know that there's weak coordination, that in order to expand and adequately distribute social welfare workforces across sectors, so for example health and education, there needs to be stronger coordination, and that's not really happening in any of the countries that we're working in. It's not happening well. So I think that's another priority area. We know there's little to no data. There have been some special studies in child protection mapping exercises done by some of you in this room that provide very important data, and yet that data hasn't gotten to a place yet where it's routinely available in systems. So we have taken this to look at what are some of the outcomes of strengthening the workforce. So what are some of the priority areas that system strengthening is looking at or workforce strengthening is looking at, and how can we measure along those lines, as well as the numbers of different cadres. So we know that some of the interventions include, and this is not exhaustive, but some examples, is on regulatory bodies and associations and strengthening both of those and making those effective to be able to regulate and support workforces. We also know, like I mentioned, that the national workforce standards, that those do exist. For example, in South Africa and other countries have those in the works, but that's still an area of, a priority area, I would say, to strengthen the workforce. We know that there are some workforce strategies. A lot of countries started developing these several years ago at a conference that was supported by PEPFAR, and a lot of people in this room, I think, were there. But countries started thinking about how can they strengthen their workforces. And so these strategies have become, I think, a little bit more advanced over time, and they're built into national strategies to support vulnerable children. And then we know that there is a movement towards improving the availability of information. So of the data that does exist, and I say sometimes the data exists because sometimes some countries have it, some countries don't, or sometimes they have accurate data and sometimes they don't. It's really, we're talking about a kind of a wide variety across the different countries. But there is some information on staffing numbers. There is some information on ratio, which we've talked about before. I should say with the staffing numbers issue, that data does exist, but yet where countries haven't yet defined all their cadres, it's really difficult for them to have information, or they just don't have information on all the cadres. In essence, it doesn't really give a full picture on the workforce. The ratio data, that has been analyzed in some contexts. The denominator is oftentimes different. So sometimes it's looking at total population, sometimes it's looking at child population, sometimes it's looking at population below the poverty line. So there's not really a set way of how to look at that yet. There's some information on vacancy rates, particularly with the formal workforce. So looking at those government positions, that's obviously limited by which positions are even established in the first place. So knowing that some countries have fully established the cadres that are required or what they think are required for now, and other countries are still in the process of identifying other cadres that need to exist. And then there is some information on turnover rates, largely through special studies. But out of all of this, almost none of it are collected, analyzed, or used routinely. So it's there and it exists in some cases, but we're still making headway in having it available routinely. So our challenge, I should say our project is to develop an M&E framework which includes indicators on the workforce. It also includes indicators on other components of system strengthening that I mentioned before. So we are going beyond the workforce in the work that we're doing, but obviously today I'm focusing on the workforce. And so some of the things that we're hoping to achieve is to find indicators that are globally applicable across a wide variety of countries. So really looking at some of those common challenges, some of the common priorities, and developing indicators that will apply. We're also really trying to learn from what exists. And in doing so, I mentioned earlier we did an extensive research process last year. We've also engaged a wide group of stakeholders, including several of you in this room, to understand what you guys know from the areas that you work in. And we've also looked to learn from the health sector as well. I think contextualizing to reality for me it's challenging, and it's really important that the context in which this will be applied in countries in Africa, they're facing very different challenges than we're facing, for example, in the United States. So we need to develop a way to monitor what's going on in terms of system strengthening in a context that is specific to sub-Saharan Africa. And then, of course, within sub-Saharan Africa and other PEPFAR countries, the context is very diverse within those countries too. So it's been a challenge, but we're trying to find those common areas. We're also looking for things that are have short-term and long-term relevance, meaning that indicators or a way to assess that we can do now through special studies and workforce mapping, but also that we can build into routine monitoring systems as they are developed. So wanting it to apply now and later. So this is where we're at. Is that we've done a lot of work and worked with the Global Social Service Workforce Alliance to develop some draft indicators. And just to talk a little bit about where we're at with these indicators is that the first half of them, you'll notice they're, well, these are the topics the indicators cover. And the first half of them, you'll notice they're kind of just saying national regulatory body, how do we measure that? Or what are we talking about when we want to measure that? So we've developed what we're calling milestone indicators. And this is really understanding that as the workforce is developed, we know it's a long-term area that's going to take years and years to get regulations in place and to get associations in place and institutions in place to be able to support the workforce. So some of the indicators that we've developed are milestone indicators to capture some of the basic foundational elements of developing the workforce. And then within that, we do want to try to capture more than just a yes or a no, but a qualitative aspect of that. So we've talked about scaled scoring, we've talked about additional qualitative questions that would come under each of the milestone indicators to provide more information beyond yes, it exists, or no, it does not, but is it functional, how is it functioning? And then you'll notice that we did take some of what the data that does exist. You know, what we want to do is create a system that's very feasible to implement, so we have to work within kind of what data does exist or what we think is realistic to be able to collect in these countries that it will be applied in. So we're also looking at some of the numbers of the workforce. We are currently proposing looking at the ratio and then vacancy rates of government positions. So where are we taking this? Which I guess it shouldn't say coming soon because not all, this is more of a suggestion of where it could go. I'm not doing all of this right now. We are finalizing the indicators, and the way that we are doing that at Measure, just to ensure broad participation as well as learning from other practices, is that we kind of release all of our work to everybody to make it very public. So we're in the final stages of being able to do that, to collect feedback, and we will do that before we finalize any sort of indicators, and that will take us into a set of more final indicators that could be released for piloting, for example, but that would have to come with specific guidance on how it could be adapted or should be adapted for each country, as well as guidance on how to apply it, how to analyze the data, and how it can be used. I think that this will eventually evolve into developing a data collection tool that is specific with some of those qualitative questions that I mentioned, but that's just a suggestion at this point. I think it would be a really important one to bring in a lot of different types of information for these type of indicators that aren't captured by the core themselves. And then ultimately we'd want to, like I said, integrate these into more routine systems and then support countries to be able to collect and use the information. That's the end.
So Dr. Mark Preston has the unenviable position of being our fourth and final presenter.
Right before lunch.
But well worth the wait, I'm certain. He's an assistant professor at Columbia University School of Social Work. His research focuses on enhancing the well-being and practice effectiveness of direct service and managerial staff in not-for-profit and public sector human service organizations. Dr. Preston's work has been published in journals such as Child and Youth Services Review, Administration in Social Work, and the American Review of Public Administration. Dr. Preston has 10 years of practice experience in the fields of child welfare as administrator, manager, supervisor, and direct service worker in Arizona and Alaska. Dr. Preston's presentation will focus on how proactive work behaviors, such as seeking feedback, can facilitate high case manager motivation when used in the framework of self-regulation.
If your stomach starts to growl, I won't take it personally. Title of my talk today is Awakening Self-Motivation in Social Service Workers, the Interconnectedness Between Seeking and Receiving Feedback. I'm going to reinforce a lot of what other people have said, but I'm also going to sort of take you in a sort of different direction. The introduction, I'll sort of clarify what goal-related feedback means, both seeking and receiving, what self-regulation means, go through my sort of hypotheses that I've been working on, the methods, the results of some of my studies, discussion, probably won't get to limitations due to time frame, and then conclusion. The social work literature has primarily focused on negative outcomes and workplace characteristics. It's primarily been a deficit-based focus rather than a strength-based focus. It views the person in the PE equation as a passive victim of a hostile work environment. It has overlooked workers as being proactive agents and positive work outcomes. By proactive behaviors, I mean behaviors that anticipate actions that impact oneself or the environment. And these types of behaviors are critical when the environment is demanding and uncertain. This is where proactivity really becomes important, and this really captures the child welfare environment. One type of proactive behavior I'm going to be referring to in this presentation is feedback seeking, or seeking feedback. When I talk about seeking feedback, what I'm talking about is a conscious effort towards determining the adequacy of your behaviors, the appropriateness of your behaviors as you're working towards something. There's 3 types of feedback seeking behaviors. One is ego-based. We seek feedback to protect our self-esteem. One is image-based. We seek feedback to protect our reputation. And what I'm focusing on is goal-related feedback. Feedback that helps us achieve the goals that we're working towards. Another fancy word you can use at a cocktail party or at a bar is instrumental feedback. So I'm looking at instrumental feedback. Now, what do I mean by receiving goal-related feedback? What I mean by receiving goal-related feedback is information that helps you attain a desired outcome. This type of feedback, instrumental goal-related feedback, is multifaceted. It has 2 facets. One is process feedback. Am I using the right strategies? Am I using the right methods? And outcome feedback. What's my progress towards my desired goal? What I am not talking about is positive and negative feedback, saying something positively and saying something negatively. You can give someone process or outcome feedback in a positive way. You can give someone process or outcome feedback in a negative way. And so I'm not talking about positive or negative feedback. Those really don't matter as long as the person is getting process or outcome feedback. My research, the basic framework of my research is self-regulation. And basically self-regulation is 3 phases that people engage in as they work towards a goal. So you can see a heavy caseload as a very difficult goal that people are trying to achieve. First thing they do is they establish the goal. The next thing that they do is they strive towards the goal. And then the last thing they're doing is that they're evaluating the progress towards that goal. How close are they? How far away are they? And so when we have difficult goals or any types of goals, we are proactive agents that seek and receive feedback as a way of working and striving towards those goals. So my first hypothesis is really that second piece of the pie, goal striving. That receiving feedback will mediate seeking feedback's relationship with work motivation. So you seek feedback, you have to receive feedback in order for you to be motivated. What this does, this enhances your knowledge and skills. This then in turn heightens your competency beliefs, your belief that you can move forward. Your sense of job mastery strengthens. I'm getting better at this job. And we feel like we're competent and better at what we're doing, we become internally motivated. So in this goal striving phase, people who seek feedback have to receive it in order to become internally motivated. At the last stage, the goal evaluation stage, seeking feedback should moderate receiving feedback's effect on work motivation. Here, when we seek feedback, we're actually seeking the precise information that we need to evaluate whether we're moving towards our goal or not. And so what I mean by a moderation is that someone who seeks a lot of feedback, gets a lot of feedback, should be more motivated than someone who doesn't seek a lot of feedback but gets a lot of feedback. That person who's seeking the feedback is actually proactively trying to get the feedback that they actually need to evaluate their goal progress. Whereas someone who is not seeking feedback, they can be getting feedback on a variety of things that may or may not be related to, am I reaching the goal of my job? Surveys that I did with Bob Dillman's method, I have 4 samples. One, child welfare case managers across the state of New York. The next one is public assistance managers across the state of New York, nonprofit agencies here in New York City, and then child care and juvenile workers in the country of Jordan in the Middle East. So comparing different contexts and how does this idea of self-regulation and social work motivation play out. The measures that I use when I talk about motivation, I'm talking about high work arousal. I feel excited about doing my job. I feel enthusiastic about doing my job. The seeking and feedback measures both measure process and outcome feedback. The statistical analysis that I did for hypothesis 1 is mediated effect with a structural equation model. And for hypothesis 2, the moderated effect was basically hierarchical moderated multiple regression in SPSS. So for hypothesis 1, 2 conditions need to be met to meet mediation. One is that work motivation has to be significantly correlated with receiving feedback and seeking feedback. So there has to be a relationship between work motivation and those 2 variables. Next is when those 2 variables are entered into the same equation, seeking feedback no longer has a relationship with work motivation because it's through receiving feedback. So without feedback received, seeking should have an impact on motivation. Once you include receiving feedback, seeking feedback should no longer have a relationship because motivation is because receiving feedback is the mechanism that makes it happen. So condition 1 was met in all 4 samples. Goal-related feedback and seeking feedback were both significantly correlated with internal work motivation. In condition 2, there was a direct effect on all 4 samples. People who received feedback, there was a significant relationship with internal work motivation. But then when I added seeking feedback, that pathway from seeking feedback to internal work motivation in all 4 samples, it was no longer significant. So in order for people to feel motivated in this goal striving phase, they have to seek feedback, receive it on how well they're doing on their job, and then they become motivated. And that cuts across all contexts. For the moderation part, evaluating our progress towards our goals, it was a little bit different story. So here the idea is people who seek a lot of feedback and receive a lot of feedback are better able to craft the information that they want and therefore be better able to determine how well they're moving towards the goal. People who don't seek a lot of feedback but receive a lot of feedback, they're just getting a lot of noise. They can't control or dictate what they need. And public assistants and nonprofit workers here, those who sought a lot of feedback and received a lot of feedback were more internally motivated than those who didn't seek a lot of feedback but received a lot of feedback. Interestingly, for child welfare and for Jordan, there was no difference. It didn't matter whether you sought feedback or not in receiving it. So that interaction was non-significant for both child welfare and Jordan. And so the question becomes, why? And I don't know. That's in my reading. But I thought that wouldn't be a good ending. So I had to come up with some more thinking, get out of bed. But before I get to that, so these are the first studies to demonstrate that receiving feedback mediates seeking feedback's impact on internal motivation. These are also the first set of studies that show that there is a moderated effect between seeking feedback and receiving feedback on internal motivation. Why a non-significant two-way interaction for the child welfare? So pauses for drama. Child welfare works in a highly uncertain environment where there's a lot of responsibility, and if you're wrong, there are life-threatening consequences. And so this idea of, am I working towards the goal properly? What's the goal? Is the goal to maintain the family? Is the goal to protect the kid? I have returned kids and been very, very concerned. I have removed kids and been very, very concerned. And so in child welfare, this idea of workers working towards a goal is very ambiguous. So what this research is sort of suggesting is if you really want to motivate workers, you've got to develop their job mastery, their skills, because the goal outcome is so ambiguous. Using that as a motivator may not be effective. What about for Jordan? Great needs and scarce resources. If you're working towards a goal and you realize you don't have the resources to achieve that goal, seeking and receiving feedback is not going to be motivating. The need is so much greater than the resources that you have, and so you intuitively know that you're never really going to reach the agency's mission. Then it's not going to happen. So again, but even for the Jordan sample, this idea of building job mastery, I feel good at what I'm doing, and when I do, I'm doing it well, is powerful internal motivation. Another thing that might be at play in the Jordan sample is good old Maslow. Now, Maslow does not hold at the individual level as a theory of motivation, but the evidence does show that it holds at the national level. So in countries like Jordan, just having a job is critical. Meeting our basic needs is critical. Whether I'm actualizing the agency's goal is secondary when I'm struggling to meet my basic needs and I just basically need a job. In fact, what happens in Jordan is if you're not performing well, they just move you to a different job. So the idea of firing people is really not there because people need a job. If they don't have this job, they're probably not going to have another job. So they just move people around. And so meeting the goals of the organization is sort of secondary in this environment. So the implications of this seem to suggest that internal motivation is enhancing mastery of one's job. People feel good that they're doing their job well. Seems to be very robust. The idea that achieving a goal, that people reaching goals in their organization, these meta goals, may not be so robust. It may be context specific, and so we have to think carefully about the context that workers are in. And so this really questions the idea of performance measurements, especially in a place like child welfare. Idea of institutionalizing channels of effective seeking and receiving feedback. This is why I think family team conferences are so effective. Workers are able to seek feedback from a wide range of players. They receive it, and then they're better able to see if what they're doing is correct or not. And lastly, what this holds for supervision is agencies really need to think about teaching workers to be proactive. I fully believe that workers are proactive. They learn not to be proactive very quickly when they don't get the feedback that they need from their supervisors or management. So institutionalizing training. So in conclusion, social workers overlooked positive worker behaviors, positive work outcomes. Social workers are proactive beings coupling goal-related feedback and receiving feedback in a self-regulation framework can be a very cost-effective way for increasing internal motivation. So thank you very much.
Well worth the wait. So I know that we're already 15 minutes into our lunchtime. I'm looking at our, do we have any time for
Yeah, what
questions?
we'll do is we'll do 15 minutes now and push the next session back to
Okay.
1:30.
Okay, so maybe 2-3 questions. And I know I have lots of questions, but I don't want to dominate this discussion. I could start with a question, but I hope that you all have questions to ask as well. Because my perspective is very unique. I work for an organization that funds social service workforce strengthening to some extent. And I, listen to these presentations and I keep thinking, okay, where's the biggest bang for our buck? I talk with government. I talk with government officials all the time, and they always say we need to increase our workforce. We have too many vacancies. But do we necessarily know that increasing the workforce is going to have a positive outcome on the well-being and protection of kids? I'm thinking now that maybe we need to focus on supervision, or maybe promoting feedback. But I would love to hear more from our presenters about make a case for me about where we should be putting our money. And is it a combination of things? Is it a package of different interventions?
Could the speakers please go back up, if you don't
Good
mind?
idea, yeah.
Thank you. Thanks.
Yeah, I think Rebecca would go. Great.
Good question, Maury. And I think that it's hard to separate the workforce from the system of services. I mean, I think that goes hand in hand. And in my experience, and we've gone through this in the state of New Jersey as well. What do we want practice to look like? What do we want our system to look like? And I think it goes back to some of the discussion earlier this morning, is that needs to be, that I just don't think designing the workforce has to go hand in hand with what it is that the system needs to look like. And one of the things that I was doing some work in Swaziland, and which you and I had talked about, and there was a lot of use of words like case management, social worker, and some of the USAID, UNICEF staff, they were saying, I really don't think we've ever really defined what this means for us. What is case management? And can you give me some examples of different models of case management? From your more intensive kind of case management to your more kind of supportive case management. So really trying to figure out, and some people don't like to use the word models or frameworks, but really trying to figure out what all this means. So I think that there's a disconnect there sometimes. That's my experience.
I also think that one of the dilemmas we get into is that we have limited resources. So USAID has limited funds. And so you're sort of like, well, what are the pieces that are the most important? And I think, from listening to part of this conversation today, that having some kind of supervision is important. But you can't just have supervision, because you have to know, what are you supervising people in, which gets back to, what is the purpose or the goal of the program. But I think that there are some core things that should be essential in terms of really thinking about what the work is and what kinds of, competencies. So if you think about the competencies for the work, and how do people get those competencies, and I think that goes back to what the first set of presentations this morning and talking about the associated clinicians or things like that. Thinking about what are the competencies that people need, and then what are the supports that are needed to get them. Because, when Mary was talking about the ways to thinking about measuring or evaluating, those are very much like process pieces, many of them, but they're sort of like, what are the pieces you have in place? But once again, you can have standards, but how do you apply them, or do they get applied, or things like that. So really thinking about some of those process pieces, I think are important also.
I think whenever you're dealing with a problem, the most effective interventions address the macro, the meso, and the micro. And so the macro issue for child welfare is not the beginning of the system, it's the end of the system. And so many other systems have failed in order for that family to get to the child welfare system. And so these other agencies, community partners who are being paid billions of dollars annually are failing as well as the child welfare system, but the blame is ultimately placed on the child welfare system. At the meso level, a couple of things. It's not just training and supervision, it's fragmented responsibility. So child welfare agencies play hot potato. The intake unit passes on to investigations unit, who passes on to reunification unit, who passes on to the adoptive unit as quickly as possible to keep their caseloads low. And that's a Taylorism. What should happen is that there should be one unit with one supervisor who's responsible for the case all the way through. That supervisor is then supervising these various individuals who have these different roles. That way you sort of hold accountability. And then lastly, at the micro level, it is, what competencies do workers need? Do we want investigators or do we want social workers? So I think we have to look at it holistically across those three levels.
All right. Yeah. Thanks to all four of the presenters. Those were great presentations, and I liked some of the things that both were independent but also flowed through. And back to the question that you raised, I think, Rebecca, one of the things that I wanted to add to your presentation on the Nigeria work, there has been quite a bit of work done on mapping the child protection systems in many countries in sub-Saharan Africa with both Maestro and Child Frontiers. And I think it's evolved, because I think one of the things that happens, they discovered they could do these reports with data about all the variables you listed, but oftentimes it would be so much data that people wouldn't know what to do with it all. And people would get paralyzed somewhat by the policy implications and the decisions and actions. And so what Nigeria represented was a different approach. And that approach was to try to make it not a research project with a team of 8 people that came in and collect data and then wrote a report and then gave people the report, but it was much more participative. So each of the states that they were working in, there was some training of some coordinators to help, but it was trying to draw from the different stakeholders that you described and involve them in the process with the idea that you would then be able to describe the context of the jobs and what was needed a bit better and what really happened and where the gaps were in real time. And I think that's a very important departure. Because the idea was this, and then Rebecca, maybe you haven't reached this stage yet, but I'd appreciate any thoughts you had on it, was that because the people involved also had some impact on decisions and policy, it was more likely that they would participate in making decisions and in pushing policy and in implementing those policies. Because one of the big issues is you can have data, but if that doesn't get used to change policies or to promote action, it doesn't do any good. So that was one of the impeti for actually trying to have a more participative approach. So I'd like to hear maybe where you are with that and what's happening with it. And then just one last item on the feedback thing. I've sort of swam in those waters for a long time, and it seemed like, I think there's a real set of skills that you need to both ask for feedback and receive feedback, and most people don't have them, and in fact get very, either ask the wrong question, how bad did I do on that, or get very defensive when people start providing. So I'd appreciate any thoughts you had about that.
I'm not sure exactly which part of that you want me to respond to.
Decision-making, action, implementation, I mean, the
You mean in
whole,
terms of
Nigeria,
what
the whole idea,
what
I thought, around the stakeholder involvement in that was that so they could not only contribute their data, their impressions, but they would also be involved in saying, okay, now that we've got that, what do the gaps look like? What are the key areas we should be investing in, and how do we, in this state, make those decisions and move it forward? I mean, that was where we started. I don't know where it ended up.
Yeah, I mean, the next part of this, now I don't know exactly how we're going to pull together all of this different information and use it. Like I said, the case studies was, I mean, I think there are other ways we can use the case studies rather than just translating it into the system priorities, I think. But the next step is to bring the stakeholders together again and then begin to look at to develop strategies. So it's really starting to do the strategic planning, but using the data, using the gaps, and then pulling together the strategic plans. And of course, Nigeria is very different in that you have the federal system and the states. So it's it presented a very different kind of test for the Maestro toolkit because they did have to, you know, it's not country level, it's state level. So I think that if we can make it work in Nigeria, but that's the next step to do that. But I agree with you. I see so many, and this is true in the U.S. as well. I see so many manuals and best practice papers, but we don't use what we know. We absolutely don't use what we know. And some people do, but there's a lot of that, and I agree. That's
the evidence is very clear that the feedback has to be task focused, not person focused. And so it's not about, you've done this case task forwardly. It's about how can we improve this case plan. So when the feedback is task focused, people they don't become defensive. Once people become defensive, if the feedback is person focused, they're no longer listening to you. There are things about how to protect their image, how to protect their ego. And so one of the key things is making the feedback task focused. Feedback also has to be specific, it has to be from credible sources, it has to be timely, accurate, but all those things are really secondary if you're not focused on feedback towards the task as opposed to feedback focused about the person.
I think this is really important issues because the sort of place that policy has in terms of how systems are structured, what kind of requirements that there are, issues getting back to that ratio issue of like, do you have supervisors and what is the quality of the supervisors, are really critical issues because there's a study that gets used a lot that was published in Research on Social Work Practice that faculty and others use to say, Intel for having a social work degree doesn't make a difference because of a study that was done in Florida that looked at evaluations by supervisors of workers. But the evaluations, if you look at what the questions were, really had to do with people being a team player. It didn't really have to do with what was the sense of efficacy. What, you were probably going to get rated worse if you were someone who really kind of spoke up and said, you know, maybe the practice should be different. So all of those things become really critical in terms of getting to these issues around workforce strengthening, is that you want people to have a sense of autonomy, but to seek feedback, to have skills and knowledge, and be able to kind of stay motivated and move that forward. And we don't necessarily have the structures to support that.
Yeah, you know, I was just thinking as you were talking, you know, how to move this forward and looking at different ways. I think it would be very interesting to use these same case studies, and then the next step would be to say, okay, what does the system, what does this child need? What does this child and family need? If you had identified this problem because the child wasn't attending school long before the child got pregnant or other problems, other problems happened. So how could we do this differently? And I think, trying different ways, just as we're trying different ways to do the assessment, but trying different ways to see how we can better get this translated into action. And this is where I think the disconnect is. And maybe we need to have more symposia around how do we translate this into action. I don't know. I think there's, and maybe looking at some of the work that was done in the health systems as well.
Clearly, we do need to have more symposium. And I'm sure that we have a million more questions and comments and things that we want to talk about. I want to encourage us first to thank our presenters one more time. And then to take those questions and comments to lunch, and you can harass them as much as you want while you're eating your sandwiches.
And I'm just here to make announcements about the next steps, because this symposium is in 2 tiers. First of all, a huge thank you. Given our collective commitment to research, the variety of methods and levels that we just saw. To quote Maury Mendenhall, that was really quite extraordinary, thank you. All of the presentations that you've seen, we will be sharing them both on the Global Social Service Welfare Alliance, Global Social Service Workforce Alliance website, and on the CPC Learning Network website. So don't worry about getting copies from people. We will have those out in the next few days. The video recording here will also be made available on a YouTube channel. So we are so 20. Our apologies for the copy misalignment. Misalignment between seeking and receiving copy. But just to let you know, I don't think we've ordered coffee for lunch, but in the next building, but there's a lot of Diet Coke, and in the next building, we're going to be in the 8th floor, but there is a cafe to the left when you come in the building if you really need some coffee. I've had a lot of questions about where I got my fabulous shirt. It is from Ivory Coast, and you can have it. I do have the phone number of the tailor if you would like to pick the postage. Or there are some great West African tailors on 116th Street. And finally, we will pick up again at 1:30 with our final panel for the day, which is looking at 3 different university research and training partnerships that are each absolutely fascinating in their own way. Lunch, yes, that's the last thing. So we will now switch buildings. The lunch will be outside of our next venue. We're not supposed to bring the food into the room, but there is kind of an atrium area where we can stand and mingle and have our sandwiches. Preston has volunteered to kind of be a leader to get us there. It's the Alan Rosenfeld building. You go out the door and it's just across the street. You may need to sign in with the security guard there. It's a bit more strict on security than this building, but quite an easy process. And then you go to the 8th floor, and then there are signs for the auditorium. So it's the 8th floor auditorium. University research and training partnerships for faculty development that we're all looking forward to. Thanks, everybody, and thanks again to the panel.
And also, if everyone could help us and pick up after themselves, we'd really appreciate it, because we're not supposed to eat in this room either.
Everyone to take their coffee cups out of the room. Because they don't really allow beverages in the room. So thank you.